senior consultant gynecologist from Kolkata. Today we are talking about endometriosis. Endometriosis is a situation that we, the gynecologists, face every day, unfortunately, and many of the women are suffering from this dreaded condition. It's a condition where the inner lining of the uterus, this is the uterus, this is the inner lining of the uterus. As we all know, once every month it comes out along with blood in the form of a period or menstrual cycle. What happens is that a little bit of this blood also goes back through the tubes and goes into our abdomen, what we call as the peritoneal cavity. For those women who are destined to suffer from this condition, that blood that gets collected in the peritoneal cavity, that is the inside our stomach, inside our abdomen, that causes a reaction. And that reaction will give rise to this disease called endometriosis. What are the main symptoms of this condition? The main symptoms are it causes a lot of pain, something that we call as chronic pelvic pain throughout the months. It can cause heavy bleeding, what we call menorrhagia. It can cause very painful periods, what we call as dysmenorrhea. Then it can also give rise to infertility, that is after marriage when one is trying to conceive, there might be problems in conceiving, so that might also be one of the symptoms. Depending on where the deposits are, if it's in front of the uterus where the urinary bladder is, there can be painful passing of urine. If it's at the back of the uterus where the rectum is, it can give rise to painful passing of stools. And also if it is right behind the uterus on the lower parts, then it can give rise to painful intercourse, what we call as dyspareunia. These are all the symptoms, and what we have to understand is that this condition is going to continue as long as the reproductive years continue. As long as the periods are continuing, this condition is going to continue. There is no treatment that is going to totally cure it. So we have to treat it throughout the reproductive years. Some of the girls in the young years, they are wincing of pain due to this kind of endometriosis. So we have to treat these girls because of the pain. Even women in the older years, 20s, 30s, 40s, they also suffer from severe pain, which in itself can be very excruciating, and it might hamper day-to-day activities, apart from all the other symptoms that I had mentioned. So this condition needs treatment almost throughout, because there is no form of treatment that we can give for a few days or a few months and to totally cure the situation. No. So the form of treatment is, one is medicine, one is surgery. Surgery is the final treatment where uterus, ovaries, all of that is removed, and that is the final treatment. Apart from that, a very common site of this endometriosis is in the ovaries, something that we call endometrioma, or in common words it's called as chocolate cyst, because the blood that gets collected inside that becomes tardy and it looks like chocolate, like liquid chocolate, molten chocolate. That's why it's called a chocolate cyst. So chocolate cyst can be removed, there can be surgery on it, but then it is not permanent. Once we treat your chocolate cyst, it can again recur after some time, unfortunately. So repeated surgeries might be required, and the more the number of surgeries we do on the ovary, the actual ovarian tissue gets lost, and so later on conceiving, because the eggs come from the ovary, so conceiving can become a problem. So too many surgeries on the ovaries is also not good. The final treatment or surgery is total removal of uterus tubes and all of that. So what we need is some kind of treatment that will help us to control the symptoms throughout the years. And so medical treatment is also available nowadays, and this medical treatment, many kinds have been tried over the years. Many had severe side effects. There is an injectable called GnRH analogs which gives good relief of symptoms, but too much of that injection can give rise to brittle bones, or something that we call as osteopenia or osteoporosis. So that is not very good for our system. Therefore those injections can be used only for a short time. So we need some kind of medication that we can give for longer periods, and one of them is progesterone hormones. Amongst the progesterone hormones, Dynogest is a hormone that is nowadays approved by all of the august bodies throughout the world. All the bodies of the gynecologist associations are approving this. It's Dynogest, and it can be given for prolonged periods in very small dose, hardly any side effect. It can be given for prolonged periods up to 5 years at a stretch, and it can give us good results. There's a lot of relief of the pain symptoms. The bleeding usually stops with it, so the heavy bleeding, the painful periods, all of that will stop. And moreover, along with it, the patient is going to feel really relieved. But the problem is, while person is on this kind of treatment, then they cannot conceive at the same time. When they need to conceive, then this kind of medical treatment has to stop, and specialized treatment for conceiving will have to be given. So in a nutshell, this is about endometriosis, and I hope I have been able to throw some light on the disease. It's not that we have to become hopeless when someone is suffering from it. We have to support our girls, our women who are suffering from endometriosis, and we should treat them with these kind of good medicines that can give them a lot of relief. And I'm sure all of us together, with our awareness, with the knowledge that we know, we can share with each other, and we can try to help the girls, the women who are suffering from this condition. Thank you so much.